صباح الخير، حنبدأ التغطية إن شاء الله الساعة 8:30، انتظرونا.
Another PET agent for apoptosis measurement is the F18ML. It is labeled with carbon 11, and here we have two labeling sites. We can label through this site, and we can label circulation and primary uptake in the heart, the brain, kidneys, and muscles. Therefore, it provides myocardial perfusion imaging and failed studies to be performed. The production of rubidium A22, because it's a generator, and the mother is the now is gaining a great interest. Why? Because it is both can be used for diagnosis. Is being used for thyroid imaging and
1979, something like this, and the production started in 1982. And the nice thing about this processing, purification, and other stuff before they send it to the radiopharmacy for dispensing.
It's not a chemistry class. You can, I have slides, I may go through them quickly, but you can discuss them later on. Glucose or FDG commonly known. This is a compound which has a radioactive F18 label at the position 2 of this. Several methods in literature. Basically, you can have mainly there are two: electrophilic fluorination and nucleophilic FDG as your product. Here's same FDG, then you this the yield of what you get out. Legal grade, and they should be all analyzed and including the containers and closures and shields. Everything has to be.
From the water to outside cylinder. And also another example of gas target is the production of rubidium 81. The nuclear reactions is krypton 81, natural krypton, converting to protons. There give us rubidium plus 2 neutrons. The half-life of rubidium 4.58, and krypton 81 half-life is 13 seconds, which is the daughter. The target design is a gas target always used. If I use the solid target. The catholic nerve target is pushed between the vertebrae.
اشتغلت على الفيديو ولا ما اشتغلت عليه؟ اشتغلت عليه. في لك اختبارات معينه. اول في 3 فلورايد ما يطلع في الاتش بي سي. 3 فلورايد ما يطلع في الاتش بي سي، ليه ما يطلع في الاتش بي سي؟ لأن الكولوم عبارة عن الاتش الكولوم ويعطينا امونيوم فلورايد يبقى على الكولوم. فالاتش بي سي ما يطلعه يحطه في الموبايل فيس. هذا موبايل فيس. تبعها بين 250 و 350.
And the first one, it's high dose in short time, and it's either death or no matter how small the radiation or the exposure will be. And the probability it's increased with the dose. For lens cataracts between 0.5 gray up to skin necrosis to 50 gray. Look at this, we're talking about gray, not milligram, because the Chernobyl people or Hiroshima, Nagasaki, or any, you have to optimize the protection, and you have to have some kind of dose limit for the occupational and public.
بإذن الله راح تكون التغطية اليوم مختلفة، راح نركز على الجانب العملي أكثر من الجانب النظري بإذن الله.
you should be 4.5 to 7.5. And this range actually is the injector. So if it's 93%, we reject the product. But in other countries, even developed countries like in the US, they
هذا السيركترون CS30 من عام 1982 موجود في مستشفى الملك فيصل التخصصي. هذا الانترنال.
زملائكم اشرح لكم مرة. هذا هو الانترنال.
طبعا هذا الهوت سيل لكن القديم، في واحد أجدد منه.
And you do the electroplating. You get a set of 6 or 4 or whatever plates at one batch. So this is less than milligram loaded on it. You're going to, screw it on this target holder through the carrier in a pneumatic tube. That's the rod inside the cyclotron, and it will go inside the cyclotron. It's going to mechanically remove the beam line. It's going to bombard. You may have heard is in your nucleus. Now what is going to do is, now it's given an example. Nucleus in an atom is like this. Is now you have a beam flux going bombarding. It has to be to convert it has a nuclear reaction. So how much is going to be? 1,000 nuclear behind within this range. But still, you're going to say that you're going to miss a lot of them. Remaining,
with the beam inside.
Yeah, inside the beam, maybe 0.3%. Depend how long is the bombardment. If you did the saturation, okay. Now you're going to, after bombardment, they're going to send it back to us. We take it and then we put the plate in a you can say dissolving tray, or if it is just your for I-123, if it is tellurium-124, just buy hydrogen peroxide, and then you precipitate it, boil it, you filter it through a sintered disc. Simple chemistry. They precipitate with a different chemistry and isolate it maybe as an oxide or something, and you're going to plate it again, use it for plating, recycling. Okay, next. You purify it, and after that you have a concentrated bulk of the isotope. That's radiochemical bulk. You send a sample. If you have 123, there should be less than 5% of 124, something like that. Or maybe less than 5% 124 with the expiry period. And then if everything is passing pH or concentration, whatever the specific activity. Once they know how much activity, how much volume, is pH, everything looks okay, then that is released, boiled or heated with sodium thiosulfate to convert any, if it's iodine, or maybe formulate it in sodium hydroxide or just sodium chloride in case of thallium chloride, this thallium, Now they're going to check pH, osmolarity, and a lot of more any other things, and radiochemical pH, multi-dose vials, 5 millicurie each or whatever, and autoclave it, steam autoclave. Then they're going to take a final sample in which they go to sterility and final tests. And if everything is within specifications, by the time it's released with that also, it will be shipped in packaging.
السلكترون اللي صورناه أول CS30، هذا السلكترون جديد C30.
It has 3 production walls, target walls.
Initial image of functional process in the body. طبعا احنا نحضر ايزوتوبس وبعدها نشوف توزيعها في الجسم. طيب the system the three-dimensional imaging of a tracer concentration within the body are then constructed by computer والبت نعمل لها اللي تسمى reconstruction. طيب بعض الاستخدامات اللي تستخدم في البت detect cancer such as cancer therapy, determine if a cancer has returned after treatment, determine blood flow to the heart. التطبيقات اللي تستخدم فيها اللي هو detect cancer. طبعا احنا في تطبيقات كثيره لها، احنا نشتغلها هنا تتبع الريسيرش لاب ونستخدمها فيها اللي هو الكاميرا الموجوده عندنا الكلاين بيس الخاص في الكنترولينج اكوزيشن، جهاز خاص فيه يسمى انكلاين. هذه اجزاء الكاميرا تريتا ريل، عندنا التاتش سكرين والاكس راي ورنج لايت والسيتي سيستم والبت ديتكتور رينج. طبعا هنا كان في الديتكتور حق الانسبكت. لما نتكلم عن البت احنا يهمنا جدا احنا نتكلم عن الكونسيدنس. فوتون جاي بشكل عشوائي في الليد في الكوليمتر، طبعا هذا عباره عن ليد يمنع الفوتون انه يروح للديتكتور.
سكاتر او
ليثيوم يوتيريوم بروتو سيليكيت. تمام، هذا الكريستال المستخدم في البت. طبعا لما ياخذ تمام يحول اللايت الى الكترونيك سيجنال. الكترونيك سيجنال تعطينا في الاخير
غطينا الجزء النظري وغطينا الجزء العملي من الهوت سيل للسايكلوترون، وانتظرونا لبكرة.
They can have water. Water is good. It's good for the patient to be hydrated because that will help the tracer excrete out. Just above 11 millimoles, they'll ask them to drink a glass of water, walk around a little bit, and come back and we check the blood sugar again. If blood sugar is still high, then we know what kind of instrument are you buying for your specific purpose, what kind of brand, what's available in the local market.
A PET scan creates 3D images of the body. It does this by using radioactive tracers, which are usually administered to a patient through intravenous injection. The tracers are made up of carrier molecules that are tightly bonded to a radioactive atom called an isotope. The carrier molecule can interact with or bind to specific proteins or sugars in the body. The carrier molecule that will be used depends on what the doctor is looking for. If she suspects cancer or is monitoring a known cancer's growth, she may use FDG, a modified form of glucose, which gets absorbed by tissues. When tissues absorb a lot of glucose, it may indicate a cancerous tumor. The radiation from the tracers poses little danger to the patient since they quickly pass out of the body. The isotope produces small particles called positrons, which interact with surrounding electrons. This interaction results in a complete annihilation of both particles, releasing two photons that speed off in opposite directions. The detectors in the PET scanner measure these photons and use this information to create an image of the distribution of FDG in the body.